Can you achieve pregnancy dreams after tubal ligation reversal? Many women wonder if they can have a second chance at pregnancy after choosing to have their tubes tied. The good news is that for many, it is possible. Tubal ligation reversal is a surgical procedure that reconnects the fallopian tubes, which can restore fertility by allowing eggs to travel from the ovaries to the uterus. Success rates vary, but studies show that about 40 to 80% of women may become pregnant after the procedure. In some cases, especially in ideal candidates, the success rate can be as high as 80%. Several factors influence the chances of pregnancy after reversal. Age plays a big role. Women under 35 to 40 tend to have higher success because fertility naturally declines with age. The type of tubal ligation also matters. Procedures that involved clipping, banding, or placing rings on the tubes are more reversible than those that involved removing a large section of the tubes or damaging the ends. The length and health of the remaining tubes are crucial. Enough healthy tissue must be present to reconnect properly. Overall reproductive health is important too, including uterine health and sperm quality from the partner. The time since the original ligation also influences success, with shorter intervals generally leading to better outcomes. The surgery itself is usually a day procedure, with recovery taking about a week. Afterward, a test called a hysterosalpingogram is performed around 3 months later to confirm that the tubes are open and functioning. While the procedure offers hope, it does carry some risks, including ectopic pregnancy, which happens when the embryo implants outside the uterus. This occurs in about 2 to 10% of cases. There is also a small chance of infection, bleeding, or other surgical complications. Because of these factors and the variability in success, many fertility specialists now recommend in vitro fertilization as an alternative, especially if the tubes are severely damaged or if the woman is older. For women with endometriosis, a condition that causes inflammation and scarring in the reproductive organs, the chances of natural conception after reversal may be lower. Endometriosis can damage the tubes and other reproductive tissues, making assisted reproductive technologies like in vitro fertilization a more effective option. In summary, tubal ligation reversal can be a valuable path to pregnancy for many women, particularly those who are younger and have healthy, intact tubes. However, each individual situation is unique. It's essential to consult with a fertility specialist who can evaluate your specific circumstances, including any conditions like endometriosis, to determine the best approach for achieving pregnancy. Always remember that medical advice tailored to your personal health is the safest way to move forward on your fertility journey.